On behalf of my two colleagues on the jury, both Dr. Anant Bhan and Amita Bhattacharya and myself, I would like to say what a great honor it has been for us to be a part of a process initiated to institutionalize the memory of Keshav and his contribution to mental health related issues in India. We would like to thank both Dr. Dinesh Thakur as well as CMHLP for this great initiative. Thank you very much. It's really very much appreciated by all of us who have worked with him. Keshav was a valued colleague and one of our finest officers. So much more has been said by both Srilata and Mr. Gandhi. I don't think I can say anything more than what they have said and cannot match wonderful description they have given of the multifaceted personality that Keshav was. He was a man of great integrity as a person and for being able to bring to the policy table issues that really matter to people's lives. He was a team player, a man of great conviction, and had a terrific sense of humor. Keshav has rightly been remembered for his work in the mental health space. A neglected policy area, he brought a rare kind of commitment and passion to ensuring that the issue of mental health is not forgotten and diligently pursued the matter till the draft bill was passed by the parliament. We have to remember that he retired, he left the ministry, but he still kept an eye on the bill even after he left the ministry to see that it is cleared by the parliament. And in fact, even after the bill was passed, he didn't keep quiet and say, well, my work is done. He chased the ministry to see that the rules are framed within a short period of 6 months. Believe me, any bureaucrat here in this audience will know that, we pass bills, but the rules take sometimes never done or sometimes takes more than a year, 2 years or 3 years. Until the rules are framed, nothing really can happen. And Keshav, knowing that, got after the ministry officials and saw to it within 6 months the rules are formulated, and with that the implementation process really started. I mean, that's real commitment, if there is any. Keshav always felt that by not prioritizing mental health in our policy, we were indeed doing great injustice, not just to those millions who needed our support, but also the army of dedicated people engaged in taking care and looking after the mentally ill. It is in recognition of the huge contribution of all such dedicated people working within the government that most oftentimes go unacknowledged that this award has been instituted. I know that this is one thing that Keshav cared most about, and I have no doubt that wherever he is, he must be happy that we are continuing the work he wanted us to do and would have done if he was alive. We were, I must confess, pleasantly surprised to get a large number of applications from people who are working in the government in the field of mental health. It made choosing the awardee that much of a challenge, and it was not without much discussion and debate that we finally decided on this year's nominee. Each applicant was outstanding, and if we could, we would have liked to have given the award to all of them. We are very happy, pleased, and proud to announce the award to Dr. Chauhan. My hearty congratulations to him. Dr. Chauhan has an impressive career trajectory of working within the system since 2002. He is well recognized within Gujarat, where he has been working in leadership positions. As member of the high-level state and national committees and task forces, he has been able to guide, advise, and influence policy. Dr. Chauhan's work stands out in terms of real-world impact. Despite the tough working environment and often facing resistance from authorities, the way the government works, if there is something that is given a low priority, particularly by the political leadership, then no one really bothers about that area. And so it's very difficult to work on an area which is not a high priority for the senior leadership or for the political leadership. But he solidly stood by and he made bold moves to advance mental health in the state, advancing the district mental health program, improving accessibility to mental health services, building patient support groups, and enhancing community mental health programs, etc., to name a few. All this at a time when mental health was given no importance and considered a low priority. To keep plodding on thus, required a massive devotion and reflected a rare zeal. And it is this quality and lifetime dedication that made Dr. Chauhan stand out, making him our unanimous choice. As the first recipient of the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health. I'm really very pleased, Dr. Chauhan. Once again, my hearty congratulations to you. I warmly extend to Dr. Chauhan my congratulations and wish him all success in future years. I do hope he continues to work harder in bringing to the fore issues related to mental health, as we have a very long way to go in our response to this silent crisis. I hope, as an inspiring leader in this field, he will nurture, mentor, and build the second line of leaders to take the task forward. I wish him all success. And lastly, I would like to say, never did I ever dream or think that, a day would come when I would be chairing a committee that is a memorial and in memory of Keshav. I really miss him greatly. I feel very sorry that he's not here. I think of him often. Not that we were very much in touch with, on a daily basis, but it was just nice that he was there. He's one person I trusted so implicitly and was greatly fond of. I really do miss Keshav. And once again, I thank Soumitra, I thank his team, I thank Dr. Dinesh Thakur for having made this possible, and to remember Keshav and memorialize him so beautifully, so elegantly, and so meaningfully for him. Mental health really mattered to him a great deal, and I'm really grateful to all of you for pushing through him the cause. And mental health is so critical for India that he was a champion when alive, and he continues to be a champion when he's not there anymore. Thank you again to all of you.